Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a special treat for you. We're going to be going over the first part of a three-part series on how to stretch with degenerative disc disease. We're going to be going over the stretches to avoid aggravating your lower back degenerative discs and which stretches are actually helpful to help keep you out of pain. Hope you enjoy. So what you have to realize about having a degenerative disc in your lower back is that too much motion in the area is actually bad for it. Most of the time with degenerative discs, there's a degree of hypermobility, meaning that although certain joints may tighten and the disc may compress, the overall ligamentous tissue that holds your vertebrae together has actually loosened. And people that are constantly stretching the lower backs many times are actually doing more damage to their discs. I go over this with multiple trainers that I teach, both athletic and personal trainers, as well as other doctors who take the Posture Size certification course. Typically, patients with lower back pain, including degenerative discs, think they're going to be doing better by stretching forward to open up the back. And that can occur in either a standing position or laying down where they bring the knees to the chest or both knees to the chest, or even sitting where they're leaning forward and to one side. Unfortunately, when you're doing this, you're taking the front aspect of the spine and compressing it even more, aggravating the compression on your degenerative discs. That's something we need to avoid if we're going to stay out of injury. A typical mistake, for instance, is a hamstring stretch, where someone will put their leg up and they'll actually lean forward to try to stretch the hamstring. Now, although hamstring tightness is associated with a lot of cases of degenerative disc, there's far better ways to stretch the hamstring. As I'm leaning forward, I'm using a passive motion where I'm just taking my spine and bending it in a flexion, compressing the front part of those discs. A far better way to stretch the hamstrings is to use an active stretch where we hold the thigh perpendicular to the body and straighten the knee. This engages the quads and reflexively helps to relax the hamstrings. My lower back is flat in a neutral position, avoids the aggravation. Having the lower back in a neutral position is a key element to preventing your back pain. We have several different videos on our website, painfreeandfit.com, as well as other videos on our channel on YouTube here. I invite you to come and join, as well as go to the website to check out where your unique posture and mechanical issues are in your lower back so you can learn to hold your spine in a stable position. Stretching and flexion, bending forward for the spine, many times is targeting the erector spinae muscles. People get tight back muscles and they want to stretch those out. As opposed to sitting and just leaning forward or standing and hanging, which the disc is getting compressed and the muscles really aren't relaxing, so therefore they're not truly stretching, it's much better to support the upper body with your hands so that my upper body weight is supported by my arms as I come forward and off to one side. In this way, although the disc is still being compressed, the amount of load on the disc is decreased because part of my body weight is being absorbed by my hands, and there's a minimized disc pressure helping you to avoid pain. It also allows the back muscles to truly relax because they're no longer engaged in trying to hold you up to prevent you from falling forward. What stretches do we need to watch out for with rotation? Many people try to twist their spines, either sitting, standing, or lying down and turning the body to one side. This puts a lot of torque on the disc, especially at the lowest aspect of the lower back, the L5-S1 junction. And this can be very detrimental to discs. It's far better when you're doing a stretch to stretch the upper part of the lower back and the mid-back, which we protect the lower back by keeping the pubic bone and the belly button moving together. So if I were to roll my knees to one side, I let my pubic bone and belly button both turn so they stay in alignment with each other, as opposed to leaving my belly button behind and rolling my hips and pelvis. That's torquing my lower back, especially at that LS junction. So whether we're lying down and twisting, or whether we're sitting or standing, we want the belly button and the pubic bone to move together. That affords the stretch higher up in the spine in the mid-back and the upper aspect of the lower back. Seated, that would be keeping belly button and pubic bone together and turning shoulders. That's a far greater stretch that helps you with your rotational movements that doesn't aggravate that lower back. Many people with lower back pain also have hip flexor tightness. A great stretch to include for degenerative discs is standing hip extension, where you put one leg back and holding the tailbone under, feeling a stretch in the groin. That can be accentuated by contracting or squeezing the buttock muscle on that side. Buttocks are usually tight in many cases of degenerative disc problems, with hip flexors, buttocks being weak in most cases of degenerative disc cases, and hip flexors usually being tight. So this helps to address both issues. The other hip flexor, the rectus femoris, can be stretched by pulling the heel to the buttock as you keep tailbone under. If you notice with these stretches, I'm keeping my spine in a neutral position. Again, learning where your unique neutral position or safe position is for your back, you can learn on other videos on this particular channel, or if you go to the Pain Free and Fit website, we've got a great new lower back healing fast track exercise program for degenerative discs that's coming out in the next couple weeks. We go over that in detail on that. Many times with degenerative discs, we have a problem with flexing forward. Many people, because they sit at desks for a long time, there's excess disc compression, and we also shorten the abdominals, and we shorten the flexor muscles that run from our neck, our SCMs and our sternalis. There's a connection between these neck muscles, our chest muscles, and our abdominals. A lot of people trying to strengthen their abs in the gym to help with their discs by doing crunches and sit-ups, where they're emphasizing the upper aspect of the abdominals, meaning that we're trying to move the rib cage down in the pelvis. That's actually problematic because you're only strengthening your typical posture dysfunction of slumping forward when you're sitting all day long. Far better to strengthen the lowest aspect of the abdominal function, which is to tilt the pelvis upwards. So if you're doing a crunch, you want to keep your tailbone under and emphasize pubic bone up with just a slight raise to your abdominal work. But stretching the abs is equally important because we have many times a shortness that develops in the top of the abdominals. We can stretch them by holding a little tailbone under to keep the pubic bone in a good alignment so it doesn't pull down and cause extension or an overarching of the lower back while we do this. And as we hold the tailbone tucked under, we lift the abdominals up and slightly backwards. We pull the face back and we extend the head a little bit. And that's going to stretch this whole fascial area from our neck through our chest into our abdominals. And you'll feel a little opening up or pulling in this area right here. That's helping to take the stress away from the typical flexion tightness that aggravates our degenerative discs. The piriformis muscle, which runs from your hip into your lower spine or sacrum, is a very common muscle to get involved with degenerative discs because many of us have an external rotated hip posture where we walk or stand with one leg out. That has a tendency to put a upwards movement into the pelvis or the hip on that side, and that compresses your discs. That's aggravating you. So one of the great stretches to undo that is simply crossing the leg and pulling the knee not only across but also up until you feel a stretch in the back of your hip and buttock area. And finally, the latissimus muscles are many times tight from having prolonged flexion or internal rotation, meaning moving our arms in our daily activities. The lat muscles run from our shoulder but all the way down to the lower back, and they can actually cause an extension stress and aggravate disc problems. So one of the ways that we look for to determine if you have a tight lat muscle is if you lie down with your legs straight and put your arms overhead. If you can get your arms all the way back without overarching your back, you probably don't have tight lat muscles. But if you go back and feel an increased arch in the lower back, that indicates those lat muscles stretching. They're pulling in the lower back, causing extension. So a great stretch for this is done by holding the tailbone under, raising your arm up, and leaning away. You can do that actively in the air, or you can also hold on to something passively with tail under and just lean away. You'll feel a stretch in your lat muscles. Remember, stretches are most effective if you hold the stretch time between 15 seconds up to 2 minutes to not only stretch the muscular aspects of the muscle, but also the fascial aspects that many times take a little longer to stretch out. So, if you like this video and would like to help me share it with others, give me a thumbs up below. If you have any questions or comments about stretching for degenerative disc disease, please leave them. I'll do my best to get back to you. As I said, if you want more information on this great subject, please subscribe to our channel. We're going to be putting out the part 2 and part 3 of the stretching program for degenerative discs, which help you avoid the typical stretches that are local to the lower back. These were global stretches that we went over today, meaning they span many joint regions at one time or many body regions at one time. But we're going to be putting out a video on local stretches and then third video on going over specific stretches for your unique dysfunctions in the disc fibers in the joint. So stay tuned on our channel for that great information. Again, a lot of this information is also available at the website painfreeandfit.com. I hope this video helps you with your stretching in your degenerative disc disease.